This is Brian with Maxtec, and this is another Minute with Maxtec. Today I want to talk about how to perform a calibration procedure and not interrupt patient care. Or in other words, the MaxBlend 2 is being used and maybe you get a reminder that the calibration is due. Now I do want to speak to the fact that that is a recommendation, and that's a reminder that it's been 7 days. By all means, use discretion that you don't need to stop patient care and perform that calibration. That is a reminder that the calibration is due. So with that, I want to show you at least one different way that you can think about calibrating a MaxBlend 2. One would be the fact that I can remove this fuel cell from the diverter nest or diverter port, and it's not affecting patient care. Okay, I'll get alarms, but right now I'm delivering a 40% FiO2 at approximately 2 liters. Okay, if I want to perform a calibration and not interrupt patient care, you might want to do it this way. I could silence my alarms. I could remove my fuel cell from the gas source, right? So now I've not interrupted patient care. Now, if you want to speed up the process of getting this into a room air environment, we would recommend removing this diverter, because there could be small amounts of oxygen or a mixture of oxygen and air trapped in our diverter. So that speeds it up. So I can assure you, as long as I don't have any other device running in this area, that fuel cell is being exposed to room air. Notice I'm still delivering the 2 liters of the 40%. Nothing's changed. I just moved it. So now I could go into the calibration process of unlocking and calibrating. Okay, so now I'm calibrating the room air. As soon as the calibration comes in, I put my diverter back on. And this will also show you and highlight how fast our fuel cells actually are. Put it back into the diverter port. It'll rapidly go to where I had it set. I had the alarm silence on, that's why we didn't hear an alarm breach. And I have now done a 1-point room air calibration without interrupting patient care. So another thing that you may take in consideration is, let's say I have a room air gas source. I have a room air flow meter. I have a room air, or I have a 100% gas source with a oxygen flow meter on the wall. You could remove this. Once again, I would suggest hitting alarm silence. Patient still getting therapy. I could remove our fuel cell. I could put it into the known gas source of room air or 100%. So let's say I have a oxygen flow meter, I have a connecting tube, maybe a clean glove. Put my fuel cell in the glove. I flush the glove with that 100% gas source. Calibrate. Didn't interrupt patient care. Calibrate's complete. Pull it out of the glove. Turn my wall flow meter off, which was a 100% gas source. Put my sensor back in. Did not interrupt patient care, and I met the one requirement of a 1-point cal at 100%. The same thing could be done in room air. If you have a room air flow meter and it's readily available, take the fuel cell out of a MaxBlend 2, put it into that room air environment, flush it. Now you can also use, maybe not a glove, but a piece of flex tube with a T-piece. I'm sure the therapists out there know what I'm talking about. The key is to flush that area that this sensor tip is being exposed to. And you know it's room air because it's coming out of the wall unit. You know it's room air because that's what we breathe every day. You know it's 100% because that's the piped in medical grade oxygen in our hospitals. So that's an example of another way of doing a calibration of a MaxBlend 2 and not interrupting patient care. For more information about Maxtec products, please visit us at maxtec.com. Thank you.